The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super, Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving to special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good evening. Nice to be with you. Hope you're having a great weekend. We have Noah and Ed running the switchboard at WR. In fact, the whole studio's on their shoulders, and they're fantastic. So if you want to speak to us, this is a live show, and you're welcome to call us 1-800-321-0710. 1-800-321-0710. Kristen Mark said the next news is going to be in 1 hour. Well, Kristen is fantastic, and she's a great announcer, but I have one minor correction. We're going to have an hour full of news. We're going to have an hour of health news, medical news, and news about what's happened to our patients. So it may not be the usual on the hour news, but it's news for you, and news for me, and news for millions of people who are listening, who can get better health care, better quality of life, better interaction with your doctors, and better information on how to live longer and more healthy. So, actually, the latest news is hot off of my phone because this woman's son just sent me an email and said, you should talk about my mother on the radio tonight, and I'm going to. But first, let me tell you, before I tell you what he wrote me, I'm going to tell you a little bit about his mother. His mother came to me just about 10 days ago. At that time, she still is a 70-year-old widow. She has one son. Her son came for consultation, and she was in excruciating pelvic pain. She was in so much pelvic pain, in fact, she was on a hospice. Hospice means it's care waiting for people to go to another, better world. Well, that's how she came to us, but let me tell you a little bit about her story. She was fine until 2 years ago when she was diagnosed with a uterine cancer and endometrial cancer. She went to the big hospitals nearby, and she had robotic surgery. Now, you've all heard about robotic surgery. It's supposed to be so hot stuff, and we've kind of disputed that. In fact, there's been stories this week even saying that for gynecologic procedures, the complication rates are higher than open surgery. We know for prostate cancer, it's higher complication rates and no better treatment. But nevertheless, let's not diverge. She had robotic surgery at a big hospital. She was told that was the hottest, baddest way to get treated. She then was told that all the cancer was contained. And a week after the surgery, she had her first complication. Yeah, she had fluids in both groins. She had swelling up of the groins. She needed drainage twice. And then, within months, she developed vaginal bleeding, getting worse and worse and worse until November. Started vaginal bleeding in September a year ago. Got worse until November. Now, this was all in the same year. She had this robotic surgery in January 2013. She had vaginal bleeding in September, 8 months later. And she had a recurrence of the cancer documented by CT scan in the same year. She had been told with robotic surgery that the cancer was contained. And yet she had complication and recurrence all in 1 year. Then she started chemotherapy, and we know that chemotherapy is pretty lousy for uterine cancer. Nevertheless, she had 6 months of chemotherapy from December until May 2014, so just a few months ago. And then she had blood clots in July. She was falling. She had worsening pain. She was even put on hospice. Her pain was getting worse. She was on narcotics. She was constipated from the medicines. She was in worse and worse shape with recurrence of the cancer, complications of the surgery, blood clots, and excruciating pain with leg swelling, put on blood thinners, came to us in severe, severe pain. In fact, she had such severe pain it was basically impossible to do a pelvic exam to examine her fully. So we staged her up. We found, in fact, the cancer had recurred not only in the uterus, but it was eating through the bone. Wow. And she'd been in hospice elsewhere. She had surgery that was useless. She had chemo that was useless. She was put on hospice. And finally, she and her son heard about us. They came to us about a week ago. We talked about all the options. She agreed to get staged up so we would know exactly where the cancer would be. We then, after we saw the staging, we met with the patient. We offered treatment to try to relieve pain and suffering. She had her first treatment this week. This is, remember, a woman on narcotics who had been in hospice. Okay, and this is what her son wrote me just about an hour ago. And I'm going to read to you. It stated today, Dear Dr. Lederman, I have some good news, exclamation point. Let's hear you mention this on your radio show. He capitalized this. Well, you know who I am, and I am reading your letter that you wrote tonight. 2 days after you gave Mom her first radiosurgery treatment, which was on Wednesday, October 8th, that awful pain she had in the crotch and pelvis came to an abrupt end. This pain had been vexing, and I'm reading from his letter. This is not my words, it's his words. This awful pain had been vexing her all summer, and the doctors did not know how to stop it. Even narcotics helped but little. So, wow. Essentially, immediately after radiosurgery, the pain went away. Most likely it will get better. Most likely the cancer will shrink. Of course, someone can have fatigue from all the pain that they've been in, from all the narcotics. Usually the effects of radiation are minimal, and she tolerated the radiation very well. She'll be back this week for treatment number 2. He ends the letter, thank you so much. So it gives you a good idea about our work. That's news. It's news because this woman thought she had no chance. This woman tried surgery, didn't work. In fact, it resulted in complications. She had 6 months of chemo. It didn't help. She went on hospice. Terrible pain. Heard about us. And in one treatment, that's the letter from her son, written tonight, the pain is gone. Now, I bet you didn't think I was going to read that letter, did you? But I did. I read all my letters. I respond personally. That's something else that's different about us. You don't get machines. You don't get students. You don't get residents. At Radiosurgery New York, people who come for cancer treatment, they speak with the doctor. You see the doctor. You speak to the doctor. We're not afraid. You can contact us 24/7. We're not afraid. We like to be in touch with our patients. So you can talk to any of our patients, and most all will tell you, I can't promise you every, because in medicine there's always somebody out there. I can tell you most patients will be like this man who wrote tonight, and he'll get an immediate response. I've already responded to him about his mother. I'm happy for the mother. I'm happy for the relief of pain. I'm happy that she can finally start living her life. And that's what we would like to do for every patient. So if you're interested in radiosurgery and the work we do, just give us a call during the work week and we'll send you a booklet and DVD. Our booklet and DVD, we have actually 3 separate booklets, one on brain tumors and brain cancers, non-invasive work without the pins and pain of gamma knife style treatment. Body radiosurgery, we were the first in America to perform body stereotactic radiosurgery, which is precise radiation to cancers, even if chemo, radiation, or surgery didn't work. Like in this woman, she had chemo and surgery, didn't work, probably even spread the cancer. And the third booklet is dedicated just to prostate cancer. So we have those three booklets. We have a DVD, and we actually have an MP3 player of our top 70 radio shows. So best is actually just to come into our office. We're just a few steps from Times Square and Herald Square. There's 50 million people who are in Times Square every year. Penn Station, where we're nearby, there's about 150,000 people. So a lot of you are close to us every day. If not, give us a call at 212-CHOICES, and we'll mail you the booklet and DVD directly to your home. This is Dr. Lederman. I'm talking about cancer treatment. Our center is a cancer treatment center, and that's what we like to do. Treat cancer. We like to help people with cancer, but we also treat benign tumors. And I'd like to talk right now about a woman who actually had inflammatory breast cancer a couple years ago. In the past, inflammatory breast cancer was also a death sentence. When I started training in cancer, I'm a board-certified medical oncologist, an internist, and radiation oncologist. I remember when one of my first patients, when I was in Boston, had inflammatory breast cancer, and back then the data was about a 6-month survival on average for inflammatory breast cancer. Inflammatory breast cancer was when the cancer encompasses so much of the breast and turns the skin almost red, like it's inflamed with infection, but it's really cancer. It used to be a 6-month survival. Well, this woman we treated more than 2 years ago. She's cancer-free today, and her medical oncologist found a meningioma, which is a benign brain tumor, and she and he decided that they want to treat this meningioma because it's growing. And so we're treating this meningioma, and we've been treating meningiomas with radiosurgery for decades. Again, we were the first in New York with radiosurgery. And what does it mean to be first? Well, you have to be pretty bold to be first. To be first means you're getting ready to be cut down by everyone else, the surgeons who want to cut and the other skeptics. Yes, but we pushed ahead. We continue to this day. Radiosurgery started for me in 1986, so it's almost 28 years. We brought radiosurgery to New York. We brought fractionated brain radiosurgery to New York. This woman's going through treatment now for meningioma, and we treat other benign tumors in the brain. We have the world's largest experience with acoustic neuromas, which are benign tumors. And some of you may know someone who has unilateral hearing loss. Acoustic neuromas are a tumor on the hearing nerve. Usually they cause hearing loss, sometimes tinnitus or buzzing in the ear, and sometimes balance problems. They are best diagnosed with a contrast MRI, which is a non-radiation test. And as I say, we have excellent data, 97% success. We also treat pituitary tumors, other benign tumors in the head, and we treat cancers in the head, like brain metastasis. Unfortunately, sometimes cancer cells get in the bloodstream, spread to the brain, and grow there. The brain receives lots of blood supply, and that's why there's many brain metastases diagnosed, actually about 250,000 a year in America. Anyway, this woman is going through fractionated brain radiosurgery for meningioma. Our data shows a 97% success rate. Our patients generally tolerate treatment very well. It's usually come in, get a treatment, 15 minutes later, go home, go to work, go to lunch, go to Macy's, go to the park, do what you want, but don't be in the hospital. This is Dr. Lederman from Radiosurgery New York. We're talking about cancer treatment and brain tumor treatment. We're located at 1384 Broadway in Manhattan. Our phone number, if you wish to call us during the work week, is 212-CHOICES, 212-CHOICES, which is 212-246-4237, 212-246-4237. We're going to stop for just a moment, hear some new voices about our work, describe our work to you. And if you have questions, call us directly at the WOR studio, which is 1-800-321-0710, 1-800-321